Bismillahirrahmanirrahim. Assalamu alaikum to all, and welcome to the online presentation. And myself, Muhammad Asim Hussain, I want to start this session with the recitation of Holy Quran. Bismillahirrahmanirrahim. Qul huwallahu ahad, Allahu samad, lam yalid wa lam yulad wa lam yakul lahu kufuwan ahad. Sadaqallahu al-azim. Myself, Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in 2004, which have vision to help and provide quality and affordable medicine for all those who are in need. Genix Pharmaceutical is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improving the lives of people associated with us at all level because we are dedicated to good health and dedicated to good brain health. Today, our session is part of educational activity and presentation topic is very unique. That is type 3 diabetes, presented by well-known legendary consultant neurologist, Dr. Bashir Soomro. Dr. Bashir Ahmed Soomro is head of Department of Neurology and Neurophysiology in Dr. Zia-ud-din Hospital, Karachi. He is professionally very busy person, but always available for education, and he is also doing his private consultancy in modeling and as well as health in institute, which is situated in DHA Karachi. Dear doctors, if there is any question, please drop your question in chat box. Question answer session will be after presentation. Over to you, sir.
Thank you so much, Asim. Thank you, Genix, and thank you, the Asim and his team. I'm obliged to present the very vast topic, which is called diabetes type 3, which is well known. It is the Alzheimer's disease, which is labeled as a type 3 diabetes. To start with the type 3, first of all, we should know Alzheimer's disease. Alzheimer's disease is the disease which is a neurodegenerative disease and which shows progression with three features. Number one is the memory loss because there is a uh, hippocampal atrophy of the brain here, and these hippocampal areas, they get degenerated and they get smaller in size. It can be, in layman terms, we can say these are the hippocampal areas are the memory cards of the brain. And if somebody who is using mobile phone or who is using camera, you put an memory card. When memory card is corrupt, your memory goes off. So this hippocampal atrophy gives you neurodegeneration, and this neurodegeneration is giving you the forgetfulness. And this forgetfulness slowly progresses, and it can lead to behavioral changes. Like if somebody who is losing his frontal lobe, that they can have a difficulty in inhibiting the things which are very important for the patient to inhibit the unnecessarily command from the brain. And these hippocampal areas, when they degenerate, they lead to the degeneration of also the temporal lobes and the frontal lobes. So frontal inhibition is very important for us, and the temporal lobes are very important for us because they analyze the memory, they analyze our brain. So somebody who is losing slowly progressive this hippocampal area, it can lead to the temporary or slightly progressive temporal lobe degeneration. If it is severe Alzheimer's disease, then there are so many faculties of the brain, like you lose your functionality of the body. So I characterize this Alzheimer's disease as a stage 1, which is a slight memory or memory loss, and stage 2 is when there is inhibition is lost, then it is leading to the behavioral changes, memory loss and behavioral changes. And after memory loss and behavioral changes, it leads to loss of daily activities of life. So this disease, as progresses, it lead to the stage A, stage B, and stage C. Stage A and stage B are very important to pick up when you diagnose the Alzheimer's disease. And when you start them on treatment, they respond very well. This is called a milder to moderate form. If it is severe, then a severe Alzheimer's disease is not reversible. So, mind you, if somebody who is 50 plus or 45 plus and he says to you there is a memory impairment or cognitive impairment in the brain, then you should investigate them, right? And you should investigate them because they can have a memory loss which is progressive and they can lead to the Alzheimer's disease. The type 3 diabetes is proposed term to describe the interlinked association between type 1 and type 2 diabetes and Alzheimer's disease. So they found there is a prevalence of type 2 diabetics. They have potential triggers to lead to Alzheimer's disease because they have neurons in the brain become unable to respond to the insulin, which is essential for basic tasks including memory, learning. Some researchers believe insulin deficiency in the central nervous system can lead to the cognitive decline. So they have linked receptor and neurons. They so the link between type 2 and Alzheimer's disease from epidemiological mechanism was introduced. When compared with the general population, the increased risk was 50% to 150% in people with type 2. So Alzheimer's disease is the most common form and causes dementia according to 60 to 80% of the all cases. So if somebody who is diabetic and type 2 diabetics, they are more prone to get the Alzheimer's disease. And these are the studies which has been published. So they published a data and in April 16, 2020, the results of epidemiological studies suggest diabetes can increase the risk of Alzheimer's disease because they found uh, insulin and its receptors in the central nervous system. So the physiological concentration of insulin exerts a beneficial effect on cognition. Mind you, when you diagnose the diabetes, there is an insulinopenic patient. So if insulinopenic patients, they lead to Alzheimer's disease. Okay. So Alzheimer's disease has already been identified as the sixth leading cause of the death in the United States and in fifth in the leading cause of mortality in 65% of age, and they are older age. So insulin insensitivity has been linked to the memory deficit, cognitive decline, and they have a type 2 diabetes. They can have a risk factor for development of the Alzheimer's disease, right? So Alzheimer's disease is a type 3 diabetes evidence. So altogether, the results of these studies provide strong evidence in the support of hypothesis that Alzheimer's disease represents the form of diabetes mellitus that selectively afflicts the brain, and positive data stems from the direct analysis and the postmortem of the patients who have diabetes along with the Alzheimer's disease. So choline esterase inhibitor in patients with diabetes, mellitus, and dementia, they conducted in studies and of 23,000 patients. They found the reduction in the mortality in patients with the diabetes and Alzheimer's disease and mixed pathology treated with choline esterase. This is the published data which has been published in diabetic brain in Alzheimer's disease. So if you give them rivastigmine, or rivastigmine is a medication which replaces the choline compounds in the brain. So Alzheimer's disease is a neurodegenerative disease which is seriously impact on the lives of the patient and their families because caregiver is very important, and it causes significant reduction in the caregiver stress and leading disability and mortality because if somebody who is suffering from Alzheimer's disease, the patient is not affected, but the whole family or whole caregiver group is affected. So rivastigmine is a approved medication for all type of the patients who have Alzheimer's. Is now being called type 3 diabetes, way to prevent cognitive decline. They'll eat less sugar, manage stress, get quality sleep and exercise. So these are the factors. So few words about the dementia or Alzheimer's disease. This is a layman term. अब्बू को भूलने की बीमारी है. अब्बू गली में गुम हो जाते हैं. अब्बू बात भी नहीं समझ पाते. अब्बू का मिजाज और रवैया बहुत सख्त है. अब्बू रिश्तेदारों को नहीं पहचान रहे. अब्बू अपने मामूल के काम में नहीं कर पाते. अब्बू आम कामों और समाजी कामों से अलहदगी रखते हैं. So I told you initially they start with the memory loss, followed by the behavioral changes, and followed by the activities of the daily life they are lost. So don't take this as a aging process or normal aging process. This is a disease which needs to be diagnosed early, and with these disease can be modified if you are, it can be halted if you start them on rivastigmine early in patients with this. So progression of the symptoms in Alzheimer's disease are mild, moderate, and severe. Mild is a short-term memory loss, language problem, mood swings, personality changes, and diminished judgment. The moderate has behavioral personality changes, unable to learn, recall new information, long-term memory affected, wandering, agitation, aggression, confusion, requires assistance with Alzheimer's. I see a lot of patients who are brought by the families to the OPD. They have a moderate type of Alzheimer's disease, and they present with this behavioral symptom, and they scream out, they wander in the room, they have a difficulty in sleeping. So when it goes in severe form, it leads to incontinence and motor disturbances. They become bedbound, and they have a difficulty in performing activities of the daily life. So they need long-term care. So we have to halt in between the moderate and mild forms, and we can start them on early treatment. So again, this is the same thing which I was telling you. So what are the recommendations for the treatment of dementia? The Alzheimer's disease are choline esterase inhibition, rivastigmine, donepezil, galantamine, dacryne, and at the diagnosis of early stages, you can start with. It can be used with memantine, it can be used alone, it can be used in combination form. Sometimes the people with Parkinson's disease, they present with the memory loss. So they have a Parkinson's plus disease dementia. They also benefit from this medication. So this is the utmost responsibility of the treating physician to diagnose early as soon as possible. Okay, so then you can halt the disease. And these are the few results of the rivastigmine, which benefit in the both cognitive as well as in the behavioral and in the activities of the daily life. I tell you, I have picked up a lot of patients of Alzheimer's disease or diffuse Lewy body disease, which in early phases or early stages, I started them on treatment, and their progression has been halted for years. I remember so many patients I have in my 22, 23 years of practice in neurology. Okay. I started my practice in 1997, and we found so many patients they benefited from these medications, and their disease and their families are very happy. So rivastigmine, it can be used in mild, moderate, and moderately severe Alzheimer's disease. It can be used alone. It can be used with the other medications like memantine. There are some supportive medications like this. Now they have invented this is called a Memor. Memor is this is a nutraceutical disease medication, but they have very good effect on the. There is a supportive medication. They compared head-to-head donepezil and rivastigmine. So they found very effective rivastigmine as compared to the donepezil. I tell you, donepezil is a medication which is used in mild form of the Alzheimer's disease. The main side effect of donepezil is a heart block. It can lead to the heart block. So when somebody who have a lot of comorbidities like elderly people, if you use donepezil, you have to be cautious about their heart condition. It can lead to the heart block. It can lead to the hypotension. So one has to consider the benefit and the risk factors by starting the medications. So they found when somebody who is having rivastigmine on their regular uses, they found it has decreased the delirium of the elderly people. Okay, so in Pakistan, when we were practicing in initial stages, so there was one molecule which was imported by the Novartis company, and they found this in the three forms or four forms: 1.5 milligram, 3 milligram, 4.5, and 6 milligram. And followed by they launched the transdermal pages also. But because this of the hike of the price of the import things are being banned by the government of Pakistan because of the dollar transactions. So we have a luxury of using Riveme, which is available in Pakistan in two forms. It is 1.5 milligram and the 3 milligram capsules are available. And you can use these oral solutions to the patients who are not able to swallow these capsule form. So dosage is very important. When you start somebody rivastigmine, you have to consider the GI side effect like vomiting, diarrhea, abdominal pain. So one has to increase very low doses, 1.5 milligram initially, followed by escalating 1.5 milligram twice per day, and followed by 3 milligram BD to up to the 12 milligram you can use. I have used the patient with 12 milligram per day in severe form of the Alzheimer's disease. So the compliance is very important in these because you have to monitor, our caregiver had to monitor the medication compliance, and they can monitor the side effect profile, and the administration should be simplified, and the optimum dose should be obtained. Then you can say this medication has worked or not worked. Okay. So, choline esterase inhibitors are efficacious in mild to moderate form of in patients with Alzheimer's disease, and they have a very good improvement in behavioral, cognitive, as well as the sleep cycles of the patients. I told you nausea, vomiting, and diarrhea are the important side effect to remember when you start patient with the Alzheimer's disease. And this is a product monogram because I am on behalf of Genix, I'm giving this lecture to you. So I want to show you because these are the three forms of medication which are available, and the noise level is very high because we use them. And so these are the 1.5 milligram capsules, 3 milligram capsules, and some drops are also available. So I would recommend the practicing physicians to monitor whenever somebody was presenting to you with this memory loss, as behavioral changes, you have to think about Alzheimer's disease, and especially those who are suffering from type 2 diabetes, you should consider to diagnose the Alzheimer's disease as well. And my message to the community is in community, because we see a lot of elderly who are being neglected by the families, who are neglected by the physicians. So I would recommend you, once you diagnose the Alzheimer's disease in diabetes, you have to take the opinion from a specialist or super specialist who has experience of using rivastigmine in titration form. And this Memor medication has been recently launched, and this is a supportive nutraceutical. Somebody is asking me the rivastigmine is more effective as compared to the donepezil. So I told you donepezil is a good medication to use initially, but donepezil has a side effect form. So one has to consider the side effect profile also. Okay.
So also, we have a question in top that is from Aghajan Muhammad. All patients of Alzheimer's can be labeled as type 3 diabetes.
No, all patients should not be labeled as a type 3 diabetes because they can be isolated as if this type 3 diabetes is labeled when somebody who is having a diabetes along with Alzheimer's disease, then you can label them as a type 3 diabetes. But in literature, now the people they consider diabetes insulin resistant and Alzheimer's disease is interrelated. So if somebody who is having an insulin resistant, they can lead to Alzheimer's disease. So this is because you see, diabetes is also a disease which can lead to the degeneration of the beta cells in the pancreas.
Thank you so much, sir. Bundle of thanks. I hope all enjoyed like me for a nice presentation, sir. It's okay, sir. Thank you so much for your presentation, sir.
Thank you so much.
Thank you.
Asim. Thank you.